Welcome to Upstate Physician Services New Haven Substance Abuse Program. My name is Dr. Bradley White, and I'm going to talk about recovery discovery. We run a OASIS licensed outpatient clinic for substance abuse. Most people have their ideas about what addiction's about, but we don't call it addiction anymore. We call it the substance use disorder. And like most diseases and disorders, there are three components: a biological component, genetic, and current thinking is about half of the reason someone becomes addicted to a drug or dependent on it or compulsively uses it is because of genetics. And then there's social context. Some groups, some people, some families drink more than others. May or may not be related to genetics, but if they have the genetics and that social context, they may start drinking in a problem way. And finally, psychological factors. And these are things that everybody may or may not learn growing up. And if you learn the right things, you may be able to beat out your genetics, just like some people don't develop heart disease in their family where everybody else did, because they were careful with their diet and they exercised and so forth. That said, we all know people who have done all the right things and still gotten sick. And that's probably why you can't always just be blaming the person who gets into trouble with drugs and alcohol for their problems, because there may be a component where they cannot help. People who become addicted and start using compulsively have a breakdown in certain things. They have a breakdown in the bonds, in shared goals and structure, the social glue that people have that keep them out of trouble and keep them within the boundaries of what normal substance use is, because 80% of us use substances, usually alcohol or tobacco, but we don't cross that line. The social glue gets disrupted somehow in the family or the society, and so that people start straying outside the lines, and then it kind of takes a life of its own. So a lot of times counselors will work on increasing your bonding, finding shared goals with people that you care about and want to keep you healthy, and also helping you provide structure for yourself. That's either within the family or within work or within the social group you're in. Now, where do you learn these things? Well, everybody's first teacher are their parents. But, a lot of times people who develop a substance use disorder, their norms get disrupted. Their role models change. Instead of seeing like Snoop Dogg as a great artist, they start glorifying his pot use. Culture. Some people are born into a culture where drugs are so normal that if they have the genetic propensity and they don't have some of the other factors I'll get into later, they're just going to wind up getting into trouble. And family. We all know families that drink a lot, but somehow they never get into trouble, because there's probably some of these other factors that are playing in force where their drinking is moderation and they have other values and a lot of structure that keep them from developing a substance abuse problem. Now, one of the other reasons people start to develop a substance use disorder is when it starts getting a hold of them, their behavioral choices start to deteriorate, and they start stop being able to make decisions that keep them out of the kind of trouble that would generate a healthy substance use rather than a dysfunctional, disordered, or diseased, or compulsive one. And that the substance use or they don't learn proper decision making, setting priorities, putting themselves first or putting their family first or their work first. They also tend to start losing rewarding activities. One of the hallmarks of a symptom of substance use disorder is that they've foregone all other activities besides seeking drugs, recovering from drugs, using the drugs, and paying for the drugs. So it becomes their lifestyle. They don't have alternatives. And I spend a lot of time trying to help people remember what they used to do before they did drugs, or getting them back into the things that they did before they used a lot of drugs. And some of those rewarding activities are work, school, and hobbies. And if they've used drugs for a while, they may have disrupted their ability to re-enter workforce or re-enter school, and sometimes people need help with that kind of thing. Finally, there's a quality called individual grit, and I guess this has been getting a little bit of attention. Individual grit is the psychological component that some people naturally have, and we all know those people who are hard-edged and they can decide what they want to do and move forward in it, and adversity doesn't seem to shake them. Well, people who develop a substance abuse problem have a problem recapturing that grit. Or they may not have had it because of some of the lessons they learned early in their life. If they had some problems growing up or had some of these other cultural things. Factors of individual grit are active response to stress. That is, rather than waiting and see what happens when the rent doesn't get paid, a person would have to take action, talk to the landlord, find out, where the money went and that kind of stuff, Coping skills. That is, rather than one of the most common coping skills, which is dysfunctional in a person who uses, is avoidance. They would pretend it's not going to happen, or it's going to go away, or they're going to get lucky. A person who has individual grit doesn't trust on avoiding a problem. They tend to take action. Part of taking action is planning ahead. And finally, a person with individual grit, they tend to be self-sufficient and self-efficacious. However, one of the things they're better at is knowing what their limits are. And the other side of knowing where your limits are is asking for help. And that's where New Haven comes in. If you don't ask a family member for help or a friend for help, or you might need to turn to a professional agency like New Haven or other licensed clinics. So, part of being a grown-up adult who has a problem, whether it's a health problem like heart disease or diabetes or an addiction disorder, you're going to want to definitely ask for help when you get to that point. Avoiding it is just going to postpone it, and the longer you postpone getting help, the quicker and deeper you're going to get into trouble, and it's going to be harder to get out.